let's measure hip flexion manual muscle testing. Many commonly used resources show the patient test position in this 90 degrees of hip flexion, 90 degrees of knee flexion position. The problem with this is we need to try to allow the joint that the muscle we're testing that crosses to move through as much of the gravity resisted range as possible. And when the patient starts in this position, you're just having them move through a small fraction of the available range to determine whether or not they meet the criteria for a 3 out of 5 muscle grade. So instead, we'll put our patient in a high seated position. So we're getting good stability of the pelvis from the edge of the table. The knees are much lower than the hip. So the hip is starting, in other words, in the much greater degrees of extension. So we can have the patient move through much more of the available range passively and then actively as we determine whether or not she is a 3. All right, you meet the criteria for a 3. We're going to place the joint in the mid-range or put the target muscles, the iliacus and psoas major, in their close to mid-range or resting length position. We can ask the patient to grab onto the edge of the table for lumbopelvic stabilization. From a stabilization standpoint with this test, the edge of the table creates the fulcrum on the opposite side of the joint that the muscles we're testing crosses. So we're testing the hip flexors. Fulcrum is going to be on the posterior aspect, just proximal to the hip joint. We'll place you at roughly the mid-range of motion. Hold it right there. Hold, hold, hold.